Washington University will study gun violence as a public health crisis. One of the issues being examined is the cost to the community. Cost of lives is clear, but as we learned, the financial cost is also enormous.
It couldn't be happening. It can't be happening to me.
This man is one of the latest victims of gun violence in St. Louis. He was hit earlier this month while simply standing on a downtown street.
I had to have CAT scans, I had to have x-rays.
He spent 2 days in the hospital, and his treatment will be very expensive. The bullet is still buried in his back, and he'll need surgery. When you get shot in St. Louis, you go to the emergency room at Barnes Jewish Hospital or St. Louis University Hospital. These are the only 2 level 1 trauma centers in the city. Doctors and nurses here see a lot of gunshot victims.
Unfortunately, some of his comparisons have been, geez, it's just like being at war.
Dr. Laurie Byrne is the chief of emergency medicine at St. Louis University. Dr. Douglas Schurer is medical director of trauma at Barnes Jewish.
The people that work here really have to be ready for it every day, and I think we are.
They see so much, they can almost predict the ebb and flow of street violence.
Usually if there's one shooting victim, there unfortunately are many. Or you anticipate, retaliation, so there are more that may happen later on that same evening.
ER staffers know their job is to treat the patient and not worry about cost. But many victims of street violence have no insurance, so ultimately the financial cost of violent crime is paid by all of us. So what is the cost of gun violence in our community? For several months, News 4 has worked with Barnes Jewish and St. Louis University to get the numbers that can help answer that question. In 2014, the 2 hospitals combined saw a total of 1,115 shooting victims. Almost half had serious injuries that required extensive and costly treatment.
Honestly, some people that are injured could be here could need lifelong care, head injury or otherwise.
An operation, intensive care unit, rehab, it could be from a week to over a month, and so it can be to the hundreds of thousands of dollars.
Using averages provided by the hospitals, we arrived at a conservative cost estimate of almost $36 million treating gunshot victims in St. Louis City for just 1 year. The real cost, of course, is almost certainly much higher. If that surprises you, you're not alone.
I think people were surprised, especially people who come here have worked other places with what they see.
The Children's Safety Network in Massachusetts estimates that gun violence costs our country $174 billion each year. Craig Cheatham, News 4.